Hello everyone, this is Dr. Deptee Warikoo, Department of Physiotherapy, Dolphin PG Institute of Biomedical and Natural Sciences. Today we will be discussing about the hand and its functions. The hand is a multidisciplinary organ in our body which has got various types of functions like motor functions and the sensory functions. Motor functions mainly are the grasp, support, striking movements, dexterity movements, expressions, sensory receptions, and orientation with the help of hand. First important function is the grasp. Grasp depends on the size, shape, weight, and solidity of the object. The fingers are very important functional organs of the grasp. Grasp could be power grip or precision grip. Power grip is when fingers are flexed around the object with wrist stabilized in extension. We can have a single-handed power grip and a double-handed power grip as well. So there are various types of power grips. We can have cylindrical grip, spherical grip, the hook grip, and the lateral prehension. The cylindrical grip involves the use of flexors to carry the fingers around the object to maintain the grasp. The fingers are always parallel to each other, and it is performed largely by the flexor digitorum profundus muscle. Cylindrical grip is most variable grip using the digits and holds the object as the thumb adducts. This is a typical cylindrical grip. Then we have a spherical grip. The extensor finger and thumb flexors and the thenar muscles follow similar patterns as in the cylindrical grip. The only difference is that the fingers are not parallel to each other here. They are spread about and thumb again is in opposition. So this is a typical spherical grip. Now next is the hook grip. The hook grip is a functional grip of fingers. It includes the palm but never includes the thumb. So it is always done with the fingers. If the load is carried more distally so that the DIP flexion is mandatory, the FDP muscle must participate. If it is proximal, then FDS muscle participates. This is the basic hook grip. Then we have the lateral prehension. The lateral prehension occurs when the contact occurs between the two adjacent fingers to hold an object. Here you can see this is the lateral prehension. The adduction of the fingers occurs along. Next is the precision grip. Precision grip is the handling with the help of fingers where much used is the fine motor control. We need the patient to have an intact sensation and should have a very good fine motor activities. The person uses his thumb as a jaw and the two fingers as 1-2 jaw or 3 jaw chucks. So we can have pad to pad prehensions, tip to tip prehensions, pad to side prehensions. The pad to pad prehension involves opposition of the pad of pulp of thumb with the pulp of the finger. It is mainly done like this. So next is the tip to tip prehension, where the IP joints of the finger and thumb must have the range and availability muscle force to create nearly fully joint flexion like this. This is a tip to tip prehension. Then we have a pad to side prehension, which is also called as key grip, like we hold the key, where the thumb is more adducted and less rotated as compared to the previous grips. This was the first function, grip. The second function is support. So body weight may be totally or partially supported by hand. Nowadays we see it very frequently in yogic postures. We can hold the weight on thumb, fingertips, little finger to support our body. Then there are striking movements which we do with the help of hand, like the slap of karate or punching, the boxing thing. Tabla, playing tabla uses the hand as a motor function organ. Then like aggression or slapping someone. Then we have the free movements which mainly focus on the sensibility of the hand. Simple movements like stroking, seizing, unwiping, washing utensils and all. These are basically fast, intricate movements of fingers. We use free movements in fast, intricate movements as well and other movements also. Fast intricated movements are like typing, playing instruments like keyboard, guitar, in which you are having a habitual function of that function of the hand, which you get habitual and then you perform it on regular basis. Then hand also works as in communication and expression. Like we use hand for gestures like namaste, bye bye, tata, come here. We also use hand in sign languages, which is mainly used by deafs and dumbs. We also use hand in dancing mudras. Then the sensory reception of the hand. The sensibility of the hand is the means by which cutaneous and proprioceptor stimuli are utilized. Here we use hand to achieve skilled motor functions. We use them to protect ourselves from the injuries or for the awareness of touch, temperature, prick, etc. We also can recognize known objects without seeing it by the eyes with the help of hands. This function is also called as stereognosis. So these are the functions of human hand, which indeed is a beautiful organ of our body. If there are any queries, feel free to ask questions. Thank you so much.